The Emergency Health Services Federation is a nonprofit organization serving as South Central Pennsylvania's Regional Emergency Medical Services Council. For the past 30 years, the Federation has overseen the pre-hospital side of healthcare, working to ensure that emergency medical services personnel arrive in a timely manner, and more importantly, that there are qualified personnel there to take care of your needs. The Federation is a grantee of the Pennsylvania Department of Health, Bureau of EMS, to provide oversight of all emergency medical services located throughout South Central Pennsylvania. This includes all EMS agencies and personnel located in Adams, Cumberland, Dauphin, Franklin, Lancaster, Lebanon, Perry, and York counties.
The Emergency Health Services Federation is the regional council for South Central Pennsylvania. We are charged with developing and improving the EMS system for South Central Pennsylvania.
The Emergency Health Services Federation helps to assure that the EMT or the paramedic is qualified to give you the care that you need, and that ambulance is fully stocked and ready with the supplies that are required for that care.
The Federation is responsible for implementing and overseeing the various federal and state regulations. They are also responsible for helping providers obtain and maintain their certification credentials while providing numerous education opportunities along the way. Every certified or prospective EMS provider begins his or her career in the classroom. The Federation is responsible for accrediting EMS educational institutes throughout the region to ensure the requirements are met to provide solid education and training.
The Federation advocates for training that's involved in provider education such as emergency medical technician and paramedic training.
We try to provide a variety of educational opportunities, from seminars to workshops, and a lot of them are based on what the EMS community is looking for. So there is some adaptability there to accommodate what's needed at that time.
There are many levels of certification within the Commonwealth, and once providers are certified, each level of certification requires continuing education classes. The Federation coordinates the availability of continuing education through the endorsement of continuing education sponsors. The Federation also coordinates the licensure for new and existing EMS agencies. Every 3 years, existing EMS agencies apply for relicensure through an application process. The Federation conducts an on-site inspection of the registered EMS vehicles to ensure units are meeting the minimum equipment and safety standards. When an existing EMS agency wishes to replace or add a unit in between licensure renewal, the Federation assists with the licensure amendment process. The Federation also assists prospective EMS agencies through the licensure process by offering a welcome packet to ensure that future services understand the laws governing EMS operations. There are a variety of licensure levels in the Commonwealth, and the Federation coordinates random, unannounced safety inspections. Federation staff also greets EMS providers at receiving facilities across the region to confirm the required life-sustaining equipment and supplies are readily available and operational in between scheduled inspections. The Federation also acts as an advocate by anticipating provider and patient needs. This includes developing relationships with the public, legislatures, and government officials.
Federation is basically a spokesperson for the providers, working closely with legislators and other organizations that would be involved with emergency services.
The Federation covers a wide geography, serves a population of about 1.8 million people. So each of those communities has specific needs, if it's urban, if it's rural, and what the Federation does is kind of combines that, gets the general picture of what's needed, and can then advocate for resources.
The Federation is also taking a lead role within the Commonwealth in developing community paramedicine goals and strategies by partnering with other national leaders. This has resulted in improved wellness, reduced costs, and a more efficient use of healthcare resources in the region. The Federation is also actively involved in many community programs, including teaching hands-only CPR to over 320,000 citizens. They have also been involved in programs like the Cribs for Kids program, which purchases portable cribs for families in an effort to reduce sudden infant death syndrome. And they have provided deployment support for Hurricanes Sandy, Katrina, and Gustav. As more and more demands are placed on EMS professionals, the Emergency Health Services Federation will be there, working to enhance the quality of EMS in South Central Pennsylvania.
I've been in EMS a long time, and I don't know that I've ever had this level of excitement over where I see the vision of EMS and our organization. It's removing that stigma of we are a response-only force, and I'm really into the fact that this is now moving towards a preventative culture. We are going to save lives before they call 911.